Call this meeting to order. First item of business is closed meeting. Be it resolved that Montgomery County Board of Supervisors of Montgomery County, Virginia hereby enters into closed meeting for the purpose of discussing the following. Section 2.2-3711, discussion or consideration of the acquisition of real property for public purpose or of the disposition of publicly held real property, where discussion in an open meeting would adversely affect the bargaining position or negotiating strategy of the public body. Number one, Allegheny Springs Consolidated Site. Discussion, consideration, or interviews of prospective candidates for employment, assignment, appointment, promotion, performance, demotion, salaries, disciplining, or resignation of specific officers, appointees, or employees of any public body. First, the Economic Development Authority, and second, the personnel. Is there a motion?
So moved.
Second.
We have a motion and a second. Madam Secretary?
Okay.
Ms. Blige?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Chair Guzekowski?
Aye.
7 ayes.
We are in closed session. Got 7:30. Is there a motion to come out of closed meeting?
Motion.
Second.
We have a motion and a second. Madam Secretary?
Mr. King?
Aye.
Ms. Bennett?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Chair Chakowski?
Aye.
7 ayes.
Okay, now we're going to move into certification of the closed meeting. Whereas the Board of Supervisors of Montgomery County has convened a closed meeting on this date pursuant to an affirmative recorded vote in accordance with the provisions of the Virginia Freedom of Information Act, and whereas Section 2.2-3711 of the Code of Virginia requires a certification by the board that such closed meeting was conducted in conformity with Virginia law. Now therefore be it resolved that the Board of Supervisors of Montgomery County, Virginia hereby certifies that to the best of each member's knowledge, 1, only public business matters lawfully exempted from open meeting requirements by Virginia law were discussed in the closed meeting to which this certification resolution applies. And 2, only such public business matters as were identified in the motion convening the closed meeting were heard, discussed, or considered by the board. Is there a motion?
So moved.
Second.
We have a motion and a second. Madam Secretary, please.
Ms. Bennett?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Chair Chakowski?
Aye.
7 ayes.
Okay, next we're going to move into our moment of silence and pledge, and we will ask our county administrator to lead us.
If we can stand for a moment of silence, and then I'll lead us in the Pledge of Allegiance. Let us pledge, please. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much.
All right, next item is presentations, recognitions, and awards, the New River Valley Public Health Task Force.
Mr. Chair, we have with us tonight Dr. Noel Bissell, and I believe Chief Anthony Wilson is here as well.
Welcome to both of you.
Thank you very much. Good evening. Thank you for having me. Time for a little update on COVID. It's still here, in case anyone wondered. Our numbers are going up. That's not unexpected, and our numbers will continue to go up until we have herd immunity, either through a vaccine or through natural infection. The campaign that we have started, Be Committed, Be Well, is a regional campaign that the task force has supported us in 100%. We're trying to get it out there on billboards, on buses, on masks, through a lot of digital marketing, because it really, the most important thing right now is, number one, we want a united message. And number two, we want to say that individual actions collectively are going to determine the trajectory of this disease. And this is not a secret. We know how COVID is spread. It is spread through close social interactions. It is following that course. We now have, I think, about 800 or close to 800 cases in the district. And as we're doing those case investigations, as we're doing that contact tracing, the connection is the behaviors, the close social gatherings, and the higher risk behaviors. So that messaging is extremely important for our communities, which include our students. And I will say that, yes, our students contribute to our case numbers, but not just our students contribute to our case numbers. Our communities do things that are social and very close as well, and we're seeing transmission. So that's the most important thing for us to do right now. The other thing is that we still have a very robust testing process. We are testing at the health department pretty much every day. So we have moved our bigger community testing with the task force support to Wednesdays. Those days are going to be in Montgomery County just because the bulk of our caseload is in Montgomery County. But on Mondays, we're in Floyd. On Tuesdays, we're in Pulaski. On Thursdays, we're in Giles. And then Fridays, we're in Radford. We still continue to have a good turnaround test time, which is very important to the contact tracing. And that's the most important thing, is to contain and mitigate the spread. So that's our big focus right now. We continue to add to our staff. We'll, when all is said and done, we will have multiplied our staff by about 7 times with contact tracers, case investigators. And then we've also repurposed some of our own staff into doing those things. The state's also hired regional folks that can help with surge capacity as well. We've also targeted some Spanish-speaking folks to help us with our Hispanic population, which has been very, very helpful with both messaging and the contact tracing. And we're really trying to do outreach with that population because they've been disproportionately affected. We continue to really meet the needs of anybody in the community. We still, if we have to, we'll do house calls literally to get people tested, or we'll bring them in whenever they need to be tested. So even though we have test sites designated, we still go and do testing anywhere and everywhere that we need to protect the public and commit to public health. The test sites, again, we do the drive-through. We're hopeful that we'll use that same setup when we do have a vaccine. Realistically, a vaccine we're looking at is the earliest would be the spring of 2021. And just to give a little context, I mean, that's more than 6 or 8 months away. And we've been doing this for about 6 months now, and it sure feels like a really long time. So we've got to continue to live with COVID and function with COVID. And we do know that basic measures go a long way to preventing it. So we know that hand washing, not touching the face, staying home when you're sick, facial face coverings, covering your cough and your sneeze, all of those things go a long way to protecting us. The other thing that we do know is that there are very high-risk populations, and then there are populations who are not high risk at all. One of the big challenges is the media and the social media tend to magnify everything, and we have to keep that perspective. And so our goal from day one, and our goal continues to be our high-risk populations. So our older citizens, our folks who have comorbid problems, our long-term care and nursing homes, our homeless shelters, our mental health facilities, and our jails. And we continue to really work to protect them. We have gotten access through some partnerships that we've leveraged to rapid antigen testing at the health department, which has helped tremendously with some of the outbreaks we've been working, because we can get those results in 15 minutes on those people that we really need to know those results, because it affects how we recommend quarantine and isolation. It affects if people can continue to work or not. And as we know, staffing at these facilities can be a premium. So we're trying not to lose sight of that, despite everything else that's going on and the natural uncertainty and the natural panic that is accompanying the rise in numbers. I will say, the numbers are numbers, and if you don't have the context of those numbers, you get lost in those numbers really fast. And, it's just every day the inquiries about, oh no, we had 20 or 30 more cases. First of all, those cases don't come all at the same time. So even if the dashboard changes at 10 o'clock, all those cases did not happen in the past 24 hours. It's not just the health department that does the testing. There are lots of other folks testing now, and the reporting varies by lab and how quickly we get the reporting. So there is some delay in some of the reporting, so that happens. And then our case investigations, what I will tell you is that by the time that data hits the dashboard, we've already done an investigation, and in many cases, we've wrapped up the investigation, and we've contained and we've mitigated the spread. So, for instance, now we're seeing increases in numbers. What we're seeing today is the result of behaviors and things that happened last week and the week before. So what behaviors we see now is what's going to show up in the next couple of weeks. And that's the most important part of our messaging is, we've seen these increases, we know why we're seeing these increases, but we've got to do better with our behaviors. And that's the biggest thing that we can do. But the absolute numbers do not worry us as much as the situation and the context of those numbers. So a large group setting of young, healthy people at very low risk, if we can contain and we can mitigate, that doesn't worry me as much as a smaller situation with very high-risk individuals. So, our priorities, they sometimes people find a hard time understanding because they're looking at absolute numbers. But the task force continues to support us 100%. One of the big pushes that will be coming up is flu. So we will be setting up our flu vaccine clinics, and we'll do them through a drive-through setting, and the task force has agreed to help with that as well. The task force has agreed financially to help support staffing for me with testing, and with our call center. Our call center, we're up over 10 or 12,000 calls now that we've fielded. We're trying to alleviate some of the concern. It's interesting because in the very beginning of this whole thing, when we were just crazy busy with people, and it was the worried well people that we had to kind of talk to because we didn't have testing. So we had to do that reassurance. And then things have kind of gone along. And now that we're seeing the cases go up, people are getting anxious again as the students have come back. People are getting anxious again as we're looking at our K through 12 go back. People are getting anxious again. And so our call center is again in the position of educating, trying to educate people. We've been testing very broadly in the New River Health District, and in the New River Valley, we've done over 25,000 tests. Our percent positivity rate, which again, those are numbers and they have to be taken in context. Our percent positivity rate remains around 3 to 3.5%. The vast majority are negative. And so when we have somebody who has practiced very low risk behaviors, has done all those things that we're trying to get people to do, they are overwhelmingly negative. When we talk about asymptomatic carriers, they're not those people. The asymptomatic carriers are people who had connections in higher risk situations. So somebody who went to a party that was higher risk, might be an asymptomatic carrier. So, again, it's that reassurance that if you do those things, you're going to protect yourself and you're going to protect the community around you. I think the other big thing to talk about is our schools going back. We very much support our schools going back. And again, looking at the metrics in the dashboards, that can be a little bit misleading. Just because the numbers are going up doesn't mean that community spread is out of control. And I'm having regular conversations with all of our school districts. And I think everyone knows that Floyd County is back in session. They've been doing well. Radford is back in session. I'm sure people heard that today there was an announcement that they were going to be put on hold for a couple weeks, but actually after we completed the investigation, it all starts with the case. And when we completed the investigation, the exposure was not significant, so they're going to be back in school this week, which I think is phenomenal. So I think everyone has to remember that it starts with the case, and then we do that investigation, and then we make our decisions and our recommendations from there. And so we're going to continue to support the schools as they work towards getting our kids back into the learning environment. Charles County started today. Montgomery County is coming up in the next couple of weeks, as is Pulaski. So that's another big thing on our agenda. And then as I was getting to flu, we're coming up on flu season. It's more important than ever that people get their flu shot because the symptoms are very, very similar. So we have ordered a significantly higher number of flu vaccines this year, and we'll really be making a big push to get the flu vaccine out in the community to try and help kind of separate those two and at least get people as protected as we can. And then in the spring, if we do have a vaccine, we will be out there administering the vaccine there as well. So I don't know if you have anything more from the task force.
Mostly my job is to stand here and look real mean at y'all so you don't ask very mean questions. No, I will tell you that you should be proud of Montgomery County. We got this thing off the ground when other counties and other parts of the state were sitting on their hands, waiting for somebody to rescue them. And it was through the guidance of our county administrator, Craig, and the other leaders of our localities who funded us the very first week we asked for it in our little tiny Montgomery County task force. And that kicked it off. It wasn't long before we figured out that we needed to represent this whole district. And we brought Giles and Pulaski and Floyd and the city of Radford on board. And they've been locked at the hip through this whole program. And so
there's not a citizen in the newer health district who is not enjoying the benefits of what started right here in Little Montgomery County. So you should be proud. And when she talks about this campaign, this communications campaign, holler at Jen, because we have built the biggest PR group probably in this side of the state with these folks. I mean, it was all of our PIOs, and they brought all their expertise because we wanted everybody in this region to be plugged into the same message. And they've done a fantastic job. They're probably one of the most important cogs of this big wheel. Dr. Bissell can put you out, like I said, I can give you the COVID underbrief if you didn't understand some of that stuff. But the biggest thing is the takeaway that I've learned is that we built a really strong machine. And every time we get into a bind, we see an outbreak. If we just can relax for about 2 or 3 days and let her contact trace, and then we test our way out of it, we're back at work. And I saw that play out in my own agency more than one time. We didn't lose a day at work. We haven't lost a sick day yet. So be proud. Like I said, this has been one of the best community efforts probably that we've ever had to endure. And I was really hoping I'd get to talk to you about ACE tonight instead of this. By the way, it's doing really well too. He's known for our kids in the schools. But no, be proud of Montgomery County, because like I said, I think Southwest Virginia, once again, is showing the state of Virginia how to do things right. And we've got the best health director absolutely in the state of Virginia. We're simply building a machine for her to work in. So thank you for all your support. And I'm sure you got questions for her that ain't much I can answer. So.
Yes, I'm quite sure that we've got questions probably. But I think I can tell you this, Chief, that we're not just proud of our county and proud of our task force. We're proud of the two of you and the outstanding job you have done. So we'll go ahead and start with questions. Let me see. Last time, I think I started on this end. So we'll start with Supervisor Biggs.
Okay, I just have a couple. Because you know how people contact us and they're worried, and and Dr. Bissell knows because I've had to call her a number of times. But anyway, one of the things, when do we worry? Like, does the positivity rate have to go up to a certain level? Do we have to have a certain number of cases? Do we have to have a certain number of hospitalizations? I mean, when is that sort of magic number as far as worry?
So there's no magic number. Definitely, if hospitalizations and death rate is going up, that's a red flag. We worry not so much about absolute numbers, but if we can't contain it. So as we're doing our tracing, it comes back to one event and a large group of people. As long as we can contain it, that's fine. If it reaches out to multiple other places and we see that starburst effect and it can't be contained, as we start to see that creep, that's when we put the red flag up.
Okay, and then along with that, I've gotten a lot of inquiries because being a former teacher, I keep in touch with teachers, and there's a lot of concern. And they did a survey, and 70% of the employees in Montgomery County schools don't feel confident about going back to work. And I guess one of the things that's sort of confusing, so when something happens like in a classroom, or how does it, so is the health department in charge of advising the schools as to what to do? As like, if you need to close down a classroom or if you need to close down a school, how does that all work?
So we're in constant communication, and it would be a joint decision because it's not so much just the infection, but it's also logistics and operational as to whether or not they have to close down. And that was part of the situation with Radford today, actually. They didn't think they would have enough subs that they could continue to function.
Right.
So from the infection standpoint, a case in a classroom or a case in the school does not necessarily mean that there's going to be anybody having to close down. And I'll tell you, and this is part of where the media, I think, really does us a disservice. They talk about all these schools that have all these cases. If you look at the actual transmission in schools, it's not significant. In other words, if the schools are abiding by their plans with distancing and masking, you're not going to see that transmission in the schools. We know this thing is spread through close social person-to-person contact. I know there's a lot of talk about airborne spread. You know, airborne is a continuum. It's droplet to airborne. I will tell you, this is not measles or chickenpox. It's not tuberculosis. And the epidemiology of the pandemic, even in our area, doesn't support that this thing is lingering in the air for hours. So yes, we're looking at ventilation systems. Yes, we want to bring in as much fresh air as we can. Yes, we want to do all those things. But the plans that every school district have put forward allow for the distancing and the masking and all of those precautions with hand sanitizer and hand washing. So the risk of transmission in the school is very, very low. People will bring it in from things they do outside, and I think that's the biggest message too, is that what we do outside of school or outside of the workplace can affect what happens in school or in the workplace. So it's not like we can clock out at the end of the day. I don't have to mask anymore. I don't have to distance anymore. I don't have to wash my hands. We have to be diligent all the time. And, we talk to people all the time with negative results. Oh, yay, so I'm free and clear. No one is free and clear. You cannot let your guard down. You cannot get lax about those basic measures.
Okay. And then I guess this one's for Chief Wilson. I have people in my district that have been riding through Main Street and seeing some of the students not following the posters on Main Street where you're supposed to walk with a mask on Main Street and all that. So is it right now you're trying to do the education part of it, or how is all that working?
Yeah, we are, and I think that some of it was part of our emergency ordinance that we wrote, and some of that language is difficult to enforce. But we're absolutely in full collaboration with Virginia Tech and with our apartment council. One of those. So what we're doing is, and I think we went through a mini section over the spring. Most people don't realize that we have about 15,000 come back in the spring, and we kind of went through the same thing. So I think they're, between a collaborative effort between using law enforcement where it needs to, our apartment complexes, and the university, that trifecta is really starting to take hold on it. So we saw, just today we were downtown, we saw probably 98% masking downtown.
Good.
So it's really starting to morph, and some of it's optics too. We have outdoor dining, which as you drive by looks a little bit more, but you'll see here in the very near future, and I think that I don't think we touched on the fact that we're building a business continuity team out of our CARES Act money, which is going to be a response team to help our businesses and so on deal with the COVID outbreak. But the other part is we're going to have an ambassadors program where we'll have folks downtown, not just monitoring, but also handing out the right information, handing out masks, et cetera. So we're going to start putting a lot more folks on the street to kind of keep pushing this message. So I think you'll see downtown Blacksburg a lot cleaned up a little bit.
Oh, that sounds good. And my last question is for both of you too. As elected officials, we get all these questions and we don't know how to answer them. So either I have to call Noelle or email her or something. Would it be possible to get like a weekly update from the task force, even if things hadn't changed that much, but just something to let us know, like if we get a call and constituents are saying, well, I'm concerned about this. What do you know about that? I mean, is there possible to get sort of like an update of what's going on? Just like what you said about the education program that's happening downtown, could we get that as elected officials?
That's on me. That's my part of it. That we should be doing that. My council does the same thing. We'll start that. Dr. Bissell's information, for the most part, you can find it on DDH's site. Right. But what we're doing on our task force, we'll start that this week. That
outreach part.
Yeah, just so you guys can see it and have some really good answers because we are changing things at an amazing speed. So I think that is our thought. But we'll start that this week.
Well, thank you so much. Thank you both.
Supervisor Shepherd.
For the doctor, you mentioned the rapid tests. I know early on I was told that they weren't very reliable. Is that still the case, or have they changed?
So the antigen test is about 90% reliable, meaning you have a 10% chance of a false negative. which is actually pretty good. And in fact, the organization, the company that we're using, as part of them providing us with the test, we send a sample for them to do PCR validation to get their numbers up. And so far, actually, we've had 100% correlation. The positives have been positive on PCR and the negatives have been negative on PCR, and we've run about 1,000 tests. So that's pretty good. I think the other thing people don't realize, we use Fralin Lab, and their sensitivity is very high. They are a research lab. On every single plate they run, they do controls, so they can pick up an incredibly low viral count. If you look at the commercial labs, your Quest, your LabCorp, some of these other commercial labs, their sensitivities are probably in the 80% range. So your chance of a false negative is probably 20%, give or take. So the antigen test is right in there. There is no perfect test,
Right.
but the antigen test is right in there. And I will say that our results have fit the clinical picture to a T. The people that we expect are going to be positive are positive. The people that we expect are going to be negative are negative. So no perfect test, but I think it gives us a lot of good data, and it gives us a rapid result.
One other thing, I'm also hearing about saliva testing. Is that an option for you guys, or is that coming? Do you know anything about it?
So yes, I know about it. We have concurrently collected over 150 saliva samples to submit to Fralin for them to do the nasopharyngeal swab and the saliva. And last week we submitted the final one that they needed. And in fact, this weekend they were going through the process of putting everything together. They have validated the test, meaning that it works. And they're going to submit to the FDA. And once they get that submitted, then Fralin should be able to start offering saliva tests.
Sweet, that's good. I don't have anything else, but thank both of you.
That's just it there too. You probably heard about antibody testing that took a lot of flack early on that was not as accurate. This antigen testing is a game changer, and it's 3 hours or 15-minute test when we got it back.
Really?
So it is definitely a game changer, and I'm bragging on her for a minute, but everything that was done at Virginia Tech was New River Health District. Getting the PCR up and running, getting that laboratory up and running was New River Health District. Saliva is the new thing coming out, and we are going to be one of the first. And once again, it's every one of them is a citizen of New River Health District. So that's how this machine works.
Very good. Y'all have done a great job. Thank you very much.
Supervisor DeMonts.
Hi, thank you both for being here. One question, I've got a couple of questions, but the first is from the perspective of testing access and looking specifically at our most vulnerable populations, those with extremely low or fixed incomes or with real transportation struggles. Can you explain how those folks are able to have access to testing? How do they get to testing sites if they don't have reliable transportation? Is there a cost for testing? Just so we can kind of, because that's a question that I've been asked. People are afraid to go get tested because they don't have disposable income to pay for it. And I haven't really known the answer to that.
So there is no charge for our testing. No one gets charged for the testing. And we have, we've made home visits. We literally will go to their home if they're afraid to come, or if a disability prevents them from getting there or transportation prevents them. We've also taken our bus and done some mini neighborhood testing events. If it's just a large percentage of the population that doesn't have transportation, we've actually gone and done some little neighborhood testing.
Thank you.
So we're trying to make it accessible to everybody.
And thank you for doing that. I think it's very important when you have certain segments of the population that don't seek medical care because of cost reasons, that they know that they have access to this information regardless of ability or inability to pay. Would that be possibly also the case with vaccines? Do you think?
Yeah, that would come under the funding from the state and from the federal government for vaccination.
Wonderful.
That's part of that Operation Warp Speed. The federal government's put billions of dollars into that.
Okay. And then one other question, this is a science-based question, and this is something that I've been asked recently, and I had no idea. My answer was, I'm not a scientist, so I don't know. If the virus is spread so easily by air, how come we're having to go so into the brain with the swabs. What's the science behind that?
So it's not really spread that easily there, it's spread by droplets. And the virus is in the cells. And that's part of the problem with some of the decreased sensitivity of some of our commercial labs. It really is a lot to do with the sample that you get. So if you just stick a swab in the nose and take it out and you don't get cells, their result will say no virus detected. Well, of course there's no virus because there are no cells. So you have a much better chance of getting those cells if you go back into the nasopharynx and leave it in there and kind of work it around. And that's the traditional, that's why a nasopharyngeal works. The saliva, the interesting thing is that the cells will slough off of your mouth as you're producing the saliva. And so I think that's the way that's working, is that the key is to get human cells. Because if you don't get those, the virus is in the cells, you won't see virus.
I appreciate that answer so much because I had no clue how to answer that question. Thank you both very much for being here. Really appreciate the update. Also for the updates that you are going to start giving us. I'm sure Blacksburg and Christiansburg's town councils would love that as well. So,
Okay. Supervisor King?
Thank y'all for being here. Just one question. When you go to like Montgomery County and Radford and all that, do you send your samples all to one laboratory?
They all go to Fralin, which
Okay.
is now only in Roanoke. So we'll do a testing event, and then we have a wonderful partnership through the task force with the state police, and the state police acts as a courier for us. So we'll do a testing event, say Wednesday. We'll package all those samples up, and Thursday morning, the state police picks them up and takes them to Fralin, and they get run Thursday, so we'll get results back Thursday night and Friday morning. And of course, they give us, our testing events. If we test several hundred people, it takes a while to notify several hundred people of their result, but we notify the positives first. So they give us our positive results pretty quickly, and we start working those. So we tell people, it could be a couple of days before you get your result. But the reality is that within 24 to 48 hours, we have the positive results, which are obviously the important ones.
So if it's after 24, 48 hours and you probably more or less you're negative.
That's a good bet.
There
If you
you
don't
go.
have a call from the health department after 24, 48 hours, your test was more than likely negative.
Thank you. Thank you. I
Not
appreciate
100%, But yeah.
Supervisor Blood?
Dr. Bissell, Anthony, thank you so much for being here and your leadership. I'm very excited. We're just proud of you all, for all that you've done on the task force. And this is exciting news with the SLAVA test, because people may be scared because they hear how unpleasant these tests of going up into our brain kind of thing, and they are scared. And so once we have this, it'll be much easier. People won't have that fear to test, and more people would come forward. I'm also glad to hear some of the questions that supervisors already asked about those people that may not have reliable transportation, or those communities that, especially Hispanic communities, that I'm very pleased to hear that we are doing some outreach projects, and would love to even do more, especially with winter coming and people not having transportation, or communities that might not be able to have that quick accessibility. I'm glad to hear that we still are very low positive rate, and so that look forward to getting our kids back in school and keeping our businesses running. And the campaign of being well, staying committed, it's about personal responsibility that each of us need to, that uniform message of we all need to take and play our part so that we can move forward with this. Quick question is, once someone has tested positive for COVID and they have recovered, as in the state of they're not showing any active symptoms, how long does the health department keep tabs or trace or keep up with them? Or is that something just voluntarily? Or is there any data that we can use that way, because this is obviously new, that we can trace?
So when someone's diagnosed, most people that we deal with recover fine at home. A lot of them are asymptomatic. So we don't really follow up with them. We do communicate regularly with the hospitals, so they let us know if someone has been admitted to the hospital. So that would obviously be a sign that they've deteriorated. I'll tell you, keeping up with the deaths is challenging because number one, a lot of them get transferred to Salem or Roanoke because they're the higher levels of care. And number two, a death can be, there's two ways to look at the deaths. There's a death because of COVID, or there's a death with COVID. And right now, they're all classified as COVID deaths, and it's going to take a long time to go through all the data. I'll give you an example. One of the deaths attributed to COVID in our district was someone who I'm very convinced did not have COVID. This was an individual who had not had any high-risk travel or exposures. It was early in the pandemic, and she got very sick very quickly. And I'll tell you that COVID doesn't kill people very quickly. COVID kind of drags on, and you'll hear the stories about people kind of lingering for days and weeks. And you may even hear stories about people sort of recovering and then getting worse again. So this individual got sick very, very quickly, and they had to do CPR on her. Her husband did CPR, and the rescue squad did CPR. She was never even tested for COVID, but it was early in the pandemic. There was a lot of concern, a lot of fear. We tested her husband. He was negative. We tested all of the rescue squad members. They were negative. But because the physician at the hospital was somewhat panicked, am I going to miss a COVID death, and put COVID on the death certificate, she is attributed as a COVID death. We have people, there's not been a death in the New River Health District in someone under the age of 70, and they've all had comorbid conditions. So we had an individual who had widely metastatic cancer, and her life expectancy was very short because of her cancer, and she tested positive for COVID. She never had symptoms of COVID in any way. But when she did pass away, likely from her cancer because she had COVID, she's counted as a COVID death. So it's really going to take some time to really get through the deaths from COVID. But by and large, we know that the people who don't do well are the people who are older, the people who are immunocompromised, the people who have multiple comorbid medical conditions. And we don't have the means to follow up, and to be very honest, when we do try to follow up, a lot of times they don't call us back because they're feeling better, they're going about their life, and they don't feel the need to follow up with the health department. So we kind of follow up with our hospitals and see what our admissions are looking like. And then as far as the deaths, we kind of have to wait until we see the death certificates and we get notified of that. But the one death I was speaking about, who I'm pretty convinced didn't, it took 7 weeks for that to be added to our tally. So that's the other thing, is if our death rate goes up, people think that death happened yesterday, and that's not the case. It takes a long time for that data to sort it, to be sorted out, and the death certificates and whatnot.
Thank you. So,
Vice Chair Bowman.
So this is pretty personal to me. My mother, who's 92 years old, contracted COVID back in April, and she had it for 70 days. She was pretty functional before. It's wiped her out, and she's on death's door. She doesn't have COVID anymore. She's 120 days in, but she can't speak to me anymore. She can't get out of bed anymore. She can't walk around with a walker anymore. And I would blame COVID when she dies, because even though she's not going to have it probably when she dies, is that fair to say that it'll probably be counted as a COVID death? Or
yeah, and there's no doubt that that's a situation where COVID contributed to her downfall. There's no doubt. Mm-hmm. And there are people, again, our older population, they don't have, their body just doesn't have that capacity to recover as well. Mm-hmm. And it's like, similar thing with hip fractures. Older people who have a hip fracture, and then they're not mobile. And so they become very deconditioned and weaker, and then they get pneumonia. And so ultimately their death certificate may say pneumonia, but it was really the hip fracture that led to. Mm-hmm. So this is the same situation.
Mm-hmm. So is Virginia Tech's count in the district count, or is it a separate number?
everything is included in the district count. So
Okay.
Virginia Tech students who live in Montgomery County will be included in Montgomery County's numbers. I know the university is reporting their on-campus students. We are not reporting off-campus students separately. And there's an intention to that this campaign is all about our community and unify. And I don't separate Christiansburg and Blacksburg, and I don't separate Pembroke and Parisburg. So why would I separate the college students? They're members of the community. I don't want to target them. I don't want to blame, and I don't want to shame. And as I said, it's not just the students. Our community members are doing a pretty good job with not adhering as well as they should in certain circumstances as well. So I think the universities, both universities, are doing a good job of trying to message. I think they are trying to take the path of this is a conduct issue, even if you're off campus versus on campus. They're working very closely with the law enforcement. And I think, I agree. I think we've seen some behavioral change. They suspended students. I think that got everyone's attention. We're not kidding here. There will be some accountability. College is a privilege, and I understand we've had a lot of messaging go out. We've had a lot of conversation. The ambassador program is going to be strictly students reaching out to students and saying, hey, we can't blow this. We realize that this has upended your college experience, but we all have to grow up and we all have to face this. So.
And I'm not sure if both of you know the answer to this next question, or perhaps it's Chief Wilson. So you said that 15,000 students came back in the spring. Did all 35,000 students come back, or for the most part come back for the fall semester? Do you know?
I think they're down a few on campus.
A few thousand?
Yeah, I'd say we're at 30. So we're double.
Okay. And then getting back to you, Dr. Bissell, how many people have you hired to contact trace?
So we have, so there's case investigators and then there's contact tracers. A case investigator is the person who actually calls that case and talks to them and finds out exactly who was in contact with them, less than 6 feet, more than 15 minutes, not masked. And they get a list of their contacts. Most people have probably between 5 and 10 close contacts. Our students obviously on the higher side, our community folks maybe on the lower side, unless they had a big gathering, and then the contact tracers. So we are going to have about 10 new case investigators, but that doesn't count my current staff of 1, 2, 3, 4, 5, plus my nursing staff of 7 additional folks that can all do case investigation. And then contact tracers, we're going to have about 25 of those. And again, that doesn't count the surge capacity from the state. The state is hiring a pool of regional people for both case investigators and contact tracers. So the Southwest area, we're going to be up about 100 people total to handle the cases. And just 4 weeks ago, our cases were very low and Roanoke was blowing up. I think people realized, and Galax was blowing up. So we had already hired case investigators and contact tracers. We had them work the Roanoke cases and the Galax cases. So there's that cooperation. A lot of it is done by phone, so they don't have to be in the district. So there is a surge capacity that we can depend on.
So I got tested and I was really impressed. So I called the health department. I got my appointment right away. I ended up driving up to Floyd. There's an officer right at the entrance. There's another officer, another 100 feet. And then you start seeing a lot of different officers from all the different jurisdictions. You stop at one place, they find your name, they put something in your windshield, or at least that's how it worked for me. You drive around the other way, and then you get all these fully suited up people, and they, they warn you about that thing that goes, and good thing I had a headrest because my head went back, but it didn't go to my brain. Okay. It definitely felt like it was hanging out at the back of my my nasal passage, and it was uncomfortable, but it wasn't too uncomfortable and was well worth it to find out that I was negative. At that time, it was just coming out that you should wait about 5 days after you think that you might have contracted. And I had traveled quite a significant distance, so I stayed home until, I guess it was only 3 days. And it was after that when I heard about the 5 days. Is that still the case, 5 days? You get a much better reading or,
So there is no magic number. We're saying on average 5 days because most people that we see, are symptomatic by 5 days if they're going to be symptomatic. And so to be symptomatic, your viral load has to have gotten up to a point that it's causing symptoms. And so you want to get that person when their viral load is going to be the highest. 3 days is probably adequate for most people. But the outliers, it might take a little bit longer because even though you're not symptomatic yet, your viral load is up. So there is no guidance on this. We've never seen it before. We do know it behaves differently than other viruses, so we don't know for sure. But we do kind of say 5 days is sort of where we see symptoms. As far as being infectious, so we know that there are some people who are totally asymptomatic. They never develop symptoms. And those people we know have a lower viral load overall, which makes sense. And those people, their risk of transmitting it to others is lower. That's different than pre-symptomatic. Pre-symptomatic people are people who aren't symptomatic yet, but they ultimately do develop symptoms. And we know those people are most infectious and they tend to have viral loads in the half day before the symptoms actually start through the day of symptoms. And then once their symptoms develop, that viral load drops off pretty quickly. And their infectivity actually goes down after symptoms start. So that's kind of where we look at trying to do the testing. I will say that when someone tests positive, the CDC has done really very good studies. You could test positive for 3 months or more. But that doesn't mean you're infectious for 3 months or more. You can be shedding what we call non-viable virus. So the CDC has some really good studies that you don't shed viable virus longer than about 9 days after showing symptoms. And that's where the 10-day recommendation comes from, 10 days from the onset of symptoms.
Interesting. Earlier, when you were answering one of Supervisor Biggs's question, you said we should be concerned if we start seeing a starburst of uncontained or something like that. How do we know when there is a starburst of contaminated or whatever that is?
So that's with our contact tracing and our case investigations.
But how do we know? Like the numbers might be going up. You would say, hey, we have a starburst. Okay.
If we're seeing that happen, we're going to put out that message before you see those numbers going up.
Okay.
Because our contact tracing and our case investigations right now, as I said, we contain pretty quickly. We find out, you have a person, place, and time. And by and large, we get a cluster of people that are connected by person, place, and time. When we start seeing people that are not connected, or somebody from this cluster is now got this cluster going, and then that cluster going, and then that cluster going, we're going to see that before you see the numbers. So we're going to be putting the red flags up before you see the numbers if we're worried that it's getting out of control.
And what would the red flag look like, or what would we hear or see?
I would be coming to you, I would be talking to our schools, I would be saying, we have pretty significant community spread that we are not able to contain.
Okay.
So we need to reevaluate and look at mitigation strategies. If our schools are in session, we may need to pull back and go remote. We may be coming to you saying, we need to look at, do we need to enact local ordinances or local measures to really encourage people that there's just too much social gathering going on right now, and we've really got to rein things in.
The other thing we do is we check our hospitals every day. The CEOs of both Trillium and HCA system are on our calls every morning, and not only are we looking at their capacities, We look further up the creek, and we look at Roanoke and Salem, we look at UVA, just to see if there's a log jam that may start affecting. So, and remember, we still have emergency proclamations out there that while the governor has kind of let region for region do it, we have a lot of autonomy about, we can return to phase one. But it's going to be a very open conversation. If Dr. Bissell starts to see it, if our hospitals start to get nervous that they're losing their capacity, it'll be immediately going to our administrators, going to our boards and our town councils to say, we're going to have to start taking some serious measures to control what we think is an outbreak of that kind of magnitude. So I think you're going to see it, and I think that's where I really need to start giving you a report, because we check it daily, and if our hospitals think they're getting just a hint of a problem, it's a collaborative effort right away to look and see how we mitigate it as quickly as possible.
Do you believe that what we have in place today will, for the most part, prevent these starbursts from happening, or these starbursts are inevitably going to happen and it's just a matter of time?
No, I think what we're seeing right now, the numbers we're seeing are definitely in our younger demographic, and they have their clusters and their social groups. So we're not seeing these huge outbursts from there. So if the pattern continues, which we expect it will, I think we will see increases in numbers. We will definitely see increases in numbers, but it's going to be in the demographic that, as long as they keep it to themselves, we'll be fine. And the messaging will be, keep it to yourself. And that is the messaging with every young person. And yes, a lot are students, but they're not just students. There are a lot of young people in the community as well. The message is, you're right, you're going to do fine with this, because most of them have no symptoms or minimal symptoms, and you're going to do fine. But what if you go to the store, or what if you go to church, or what if you go here? So I need you to not be going to church right now. I need you to not be traveling. I need you to not go anywhere near my nursing homes. I need you to not get arrested for something stupid and end up in my jail. I need you to really not do something stupid that you end up in the emergency room. And that's been our messaging with every single case and contact that we talk to. Everybody gets that spiel. You need to keep this, contained.
So are you guys getting sleep these days?
A little bit.
A little bit? Good.
No, I think the other thing that the reassuring factor that we saw from the beginning was putting in checks and balances in our critical infrastructure. So our nursing homes are testing in, they're isolating in, they're checking staff. That's where this antigen testing too has been such a godsend for us, because, the sheriff is running a really well-oiled jail. We've not had a single case in there, but we also reinforce it with testing in. We're probably the only mental health district in the state that will have testing available for every mental health patient who needs placement. So we feel pretty comfortable that nothing's perfect, but we put a lot of safeties into that critical infrastructure. And it's pretty amazing to see that an outbreak kind of stays put, and we're not seeing a lot of transmission outside of that little cluster. So I think that's a tribute to some of the safeties that Dr. Bissell's helped us put in.
And I've been incredibly impressed right from the beginning how we did form the task force so early on, did start testing so early on. I think it was, can be attributed to the great leaders that we have in the community. I'm so glad to hear, Dr. Bissell, that you're probably the best in the state. Yay, Montgomery County. And of course, Chief Wilson, you're the best too. Besides Sheriff Partner, of course. But besides that, no. But thank you very much for everything that you do. I know you're saving lives out there, and it really makes a difference.
Okay. Y'all are staying up there a little bit longer than you probably had planned on, but you wouldn't believe how many questions we get and how many questions that we all come up with leading up to this. So maybe we might have to make you a feature every meeting. You don't want that. I just got a few. I just heard recently, Dr. Bissell, and I'm trying to remember who it was that told me that they think that the antibodies that you produce in response to COVID-19 may actually protect you forever.
So, yeah, there's the antibody response. Number one, we just don't know because we've only been dealing with this for 6 months. But people have to understand there's a couple of parts to the antibody response. There's the actual T cells, which are the antibodies that you generate. And that made big media attention that, oh, they wane, after 3 or 4 months.
Right.
But then there are the B cells, and those are the memory cells. And those B cells, even if your antibody levels go down, if you are, exposed to that antigen, that virus down the road, those B cells kick in and say, hey, I've seen this before. I'm going to start kicking my T cells to produce those antibodies. It's called an amnestic response. And so there is a lot of hope that, yes, that antibody response, even though the actual measurement of antibodies goes down, that immunity will last longer. And we don't know, and we won't know until time goes on and we see how people do, and then we see what the effectiveness of a vaccine is. But they are finding a lot of things about the way it behaves and about the way the antibodies are produced. And the antibodies are you hear the different terms about the envelope protein and the nucleic protein and the membrane protein and that spike protein. That spike protein is what makes COVID look so funky. That spike protein is how the virus gets into the cells to infect the cells. And they're having very good success neutralizing that. And so if they can neutralize that with a vaccine and that can last, then yeah, you can have much more long-term immunity.
Okay. Another science question. Is this virus, does it produce more asymptomatic victims than anything else that we've seen? Because I just seem to hear that a lot. And that was my case also. I was asymptomatic.
So what we've seen, and I think, pretty much numbers across the board, is up to 30 to 35% could be asymptomatic. Again, asymptomatic and pre-symptomatic are two different things. And so people who have allergies, for instance, and develop some symptoms may attribute them to their allergies when they really had symptoms of COVID. So it's very hard to tell for sure. But, so when we do those questions, we really nail it down. Do you have allergies? Do you have problems with postnasal drainage? Do you have these kinds of things? Did you have a sniffle or a cough or anything like that? To try and really tease out, were you truly asymptomatic or were you just minimally symptomatic? I do think there is going to be a substantial percentage that really don't get symptoms, and it's in our younger population for sure.
Well, I'm pretty young too, so that could be my problem. How are our hospitals doing as far as patients? I mean, are they getting loaded up, especially the ICUs, or are they doing okay?
So they're not loaded up with COVID patients. The hospitals, their census is much higher. So when we first started the task force and we shut down elective things and we told people, we don't want you going to the emergency department, we're going to test you outside, and their census was way down. Their census is back up. And they'll go up and down in their capacity, but it's definitely not COVID patients, but it's something that we are in communication with them regularly. And people have to understand, and the VHHA, the Virginia Healthcare and Hospital Association, they have a dashboard, and that tracks the number of people who are currently admitted with COVID. It tracks the number of people who are in intensive care units with COVID. It tracks the number of people who are on a ventilator with COVID. And they do it statewide, and they intentionally do not break it down because the system is such that we transfer patients all the time because of bed availability and acuity. And we do that even outside of COVID. So if you have a really sick patient, you don't have a bed, or a higher level of care has a bed, you transfer them. And so there's a huge network. And from around here, obviously, we transfer to Salem or to Roanoke Memorial. But I'll tell you, we also transfer patients down to Duke. We transfer them to Wake Forest, or we transfer them to University of Virginia or to Virginia Commonwealth. So that network is pretty extensive. And right now, the capacity in that network is fine. at the peak when Northern Virginia was really spiking, they had about 1,600 hospitalizations on most days. We're down around 1,100 now pretty consistently. The ventilators in use, they got up as high as about 22%, but it's kind of hovered between 19 and 22% with COVID patients. And the ICU capacity got up as high as 75 to 80%, but now it's been hovering more in the 50 to 60% range, maybe 70. And that's a daily dashboard that's updated daily. Capacity is our local facilities, but it also is much more far-reaching, and there are a lot of things that go into it. And I will say too that they definitely have seen people who have put off care because of COVID and being afraid to go to the hospital. And some of those folks are coming in sicker. So with the period where they had a lot more people coming in with heart issues because they had chest pain, but they didn't want to go to the hospital because they didn't want to get COVID. And so then they came in sicker. So we have to be really careful there too. We were almost too good with our messaging, don't come to the hospital. And people didn't, and then they came in a little bit later.
Okay. All right. Thank you. Chief Wilson, now I got one question for you. I know you mentioned the business continuity team, which I recently found more information on, but and I know you didn't come here with a list of all the things that the task force has spent their CARES money on, but can you give us a few other items that of what the task force is spending their CARES funds?
I think the biggest thing, and this is from the beginning, we wanted to have a regional stockpile of PPE. I think everyone saw that when this thing first hit, it was hard to find masks. It was hard to find. We didn't want to get into the hospital system, so we've got a storing capacity with Lewisdale Montgomery gave us their warehouse. We're spending a substantial amount of money on a 3-month supply to carry us, which we're going to kind of cycle through our local rescue squads too to keep that fresh and keep doing it. We spent a substantial amount of money on testing material. As you say, we were one of the first in the PCR market, and we were contributing a lot of funding to that. And now with antigen testing, we're hoping to increase our capability significantly on that. And our goal was from the very beginning to April's point is that while the federal government was going to fund this, that there would be no citizen in any one of our counties who is not going to get a test. There was no citizen who was not going to get a vaccine. So we spent a lot of money on that side of the fence. Our advertising campaign, and these are CARES monies coming in from each of the counties. Montgomery County is pretty much our fiscal agent for the task force, but these CARES monies are coming in from each of the other counties who were in it with us. We spent close to $300,000-$400,000 on this campaign. We're going to see another 250,000 more masks coming out. And like I said, we did look to the regional commission through our business continuity team to help stock up Dr. Bissell's crew a little bit. We wanted to take things like the call center off of her staff. We thought we could do it better with volunteers. It fit perfectly in that CARES Act funding. So I think you're going to see that. You're going to see some more human beings on the ground this fall in our ambassador program. I think our business continuity team will grow significantly because we wanted the team to come in to whatever business, if you were in crisis, to come to you with professional assistance. We wanted to give you media exposure. We wanted to give you the right testing strategy, the right mitigation. So it just simply exhausted what Dr. Bissell could do. So we decided that we would be one of the few places on earth that would build a system that we could go to any business, homeowner, school, and we could insert sort of a professional counseling group that helps you navigate not only real mitigation, but it also gives you something to talk to the media about. We've seen businesses who are crushed by bad publicity over a COVID thing. So, but those are pretty much the highlights that we're looking at. Those are first and foremost, we did not want to get into December and not have the adequate supplies for all our first responders, for our hospitals, for our health workers, and we want to maintain the ability to test our way out of any situation. So those are the first and foremost of those funds.
Okay, thank you. Yeah, I, as a member of the Regional Commission. That's where I heard about the continuity team, and I thought, wow, that's covering a lot of bases there, and that's fantastic. I don't know of any other locality that has that in the works, because it's pretty comprehensive. So I know we've asked a lot of questions. We may have answered some for some of you, but follow up.
Yeah.
Go ahead.
Right now, and this is a good forum because it's, repeated on television, it's on YouTube, but who qualifies to get a test from the health department? Because I know you've had to follow the state guidelines too. And we get asked that too, like, can I go get a test?
So we have tested anybody who wants a test. Now, testing is not a limitless resource.
Mhm.
And, it's not only the tubes and the swabs and everything else, but it's actually the lab capacity. So if you bog down the lab, you delay the turnaround time, which delays the public health. So we're trying to, it's not so much, the state regulations as we're trying to do what's called smart testing. And we're trying to get people to understand if they've had very low risk behavior. We've been doing this since March 31st was our first testing day. If they've had very low risk behavior, they haven't traveled, they haven't been socializing, their risk is really low, and overwhelmingly the tests are negative. So those folks, we try to kind of work with them to understand that their risk is pretty low. They don't necessarily need a test, but if they really, really, really need that test for anxiety or for whatever, we don't deny them the test. So we are trying to be smart with our testing, but we realize that there are some people who want to get tested and who need that to feel that comfort level. A negative test is one point in time. And the last thing we want to do is use a negative test to then enable bad behavior, which is what a lot of people do. Oh, I tested negative, so I can keep behaving badly. And we've had some people come through our sites literally every week to get tested, and we're trying to very much discourage that. But the answer is anybody who can get tested.
So the best thing they can do is to call the health department ahead of time.
And we'll work with them.
Yeah, okay, thank you.
I will say that, the PCR testing, the PCR testing is the molecular test, and on average that costs about $100 a test. The antigen testing, it's, that's still an expensive test as well because you have to pay for the cartridges. Neither of those, in my opinion, neither of those is the answer to get us through this pandemic. The answer is coming, and it's coming quickly. And I'm going to ask for a lot of that CARES money when it comes. It's a home test that people can administer a couple times a week. And there are people that are making it, and it's going to cost less than $1 a test. And it's basically going to be a color change strip. If you're positive, it changes color. If you're negative, it doesn't. If you're positive, you stay home. If you're negative, you go to school, you go to work. I'm convinced that's the way to test our way out of this pandemic, and it's coming. So as soon as that hits, that's where we need to go.
Thank you.
Told her not to say that on TV. Maybe the first one's here, so disregard that.
All right, anyone else have a follow-up question? Okay, looks like you all are going to be released here. We appreciate you coming here very much. Keep up the good work. We admire your dedication. It's very, very, very refreshing. You all have a good evening.
Thank you.
Thank you. Thank you.
Thank you.
We're going to take turns doing this tonight. Carol's up next.
All right, well, our next item is public hearing. First one is to amend the fiscal year 2021 budget. Did you want to make
Sure.
a comment on that?
This is an item that we have been required by state statute to do whenever we have an adjustment to the current adopted budget by more than 1%. And tonight on the agenda, we have several items, budget amendments, primarily related to the county schools, the school operating encumbrances, school operating fund and carry forwards, school county capital funding, and allocation of the CARES Act, second half of the CARES Act money. So Those are considerable dollar amounts, and we're required to have a public hearing per code just to see if anyone has any comments on those items.
Okay. No one has signed up to speak on the fiscal year 21 budget amendment, but if somebody would like to come forward, we will give you 4 minutes. Just state your name and address. Looking around, seeing no one, I am going to go ahead and close this public hearing, which brings us to the next public hearing. Establish voter satellite offices for the 2020 general election. And I think Connie is with us. If you could just give us a brief summary of what it is.
Sure. The board and I are here tonight hoping that each of you approve the off-site satellite location that we hope to use at the New River Valley Mall. We think it's important in light of COVID that we have two places. Most importantly, to spread people out, to give people an option. We did look at sites. The law changed July 1st, so we started contacting people June 30th and July 1st. To be honest with you, nobody wants us in their sites. I mean, when you say we only need for 45 days and 2 of those days are Saturdays, we don't get a lot of takers. So we had the Moose Lodge at the last minute say they'd love to have us there, but it was very pricey. Sarah Nucci at the New River Valley Mall wants us there, and she's only charging us $1,500 for the 45 days. If COVID ramps up and we lose people to work that site, we'll simply just pull that site and just use the government center. We don't have the machines to have other sites and staffing. Carol Williams, Secretary of the Electoral Board, barely had enough people to work the June Republican primary due to COVID. So we don't know what to expect until election rolls around. Early voting does start September the 18th and runs through October the 31st. For Blacksburg, I looked at Virginia Tech Inn, had no response. We looked at the Corporate Research Center. Carol Williams' husband actually works there, reached out to people for us, no response. First in Maine, we emailed July 1st, the same email that Mrs. Bond supplied to us just last week. No response. I have the email downstairs if you'd like to see it. We're just hopeful that we can use a second site just to give people an option to have someplace else local that they could go. The BT drops off right there at the back entrance. It's handicap accessible. It's there at the rear entrance. It's the first location on the left as soon as you walk into the mall. And like I said, Sarah Nucci has been more than accommodating to us.
Okay, very good. All right. Well,
Thank you.
you have questions?
No, so thank you.
Okay. Well, thank you very much.
Yes,
We
sir.
appreciate you coming and explaining that to us.
You're very welcome. Thank you all
Thank
for your
you.
support.
Thank you.
Thank you.
Thank you.
All right. I have the sign-up sheet here for the voter satellite offices, and we do not have anyone signed up for that. But if somebody would like to speak, oh, you have another one?
Will you do this one, Sunday?
Oh, I'm sorry. Wow.
We do have
I
one.
think I need to get stronger glasses. I apologize. There it is in blue and white. Elizabeth Openchain.
Yay, Beth.
If you'll just come forward, give your name and address. You have 4 minutes.
Thank you.
I apologize. You probably thought you were in the wrong building, huh?
No, that's fine. Good evening. My name is Beth Obenchain. I live at 2010 Prices Fork Road, Blacksburg, Virginia. And I'm president of the League of Women Voters in Montgomery County. First, I would just like to express how fortunate we are as a county to have Connie Byer as our registrar. Connie is well organized. She's very up to date on all the election law changes that have been made in the past year. And she is immediately responsive to requests or questions about how to vote or register or vote safely, whether it's the League of Women Voters or an worried individual who calls her. She's just done an outstanding job, and she has a daunting task in front of her this year with an election where we have new election laws, we have a pandemic, And we also have the post office saying they're not sure they can deliver our ballots in time. So we have heard just intense interest from people interested in voting this year, but also intense worry, because most of these people have always just gone to the polls on election day. This year, they're worried about doing that. They're worried if they send in an absentee ballot that they won't have the places marked or signed where it should be. So, and again, early voting starts September 18th. It's hard to believe it's less than a month from now. And we strongly hope that you will support Ms. Veyer's proposal for a satellite office to help deal with the influx of voters, because we've already heard about people who want to vote early in person, or they've requested a ballot, but they want to hand deliver that ballot to make sure it gets there. And having a satellite site at the mall would be very helpful. For one thing, people know where it is. They may not know where the county office building is, but they know where the mall is. But even more importantly, it is accessible to people from Blacksburg and Christiansburg, and especially to Virginia Tech students who may not have a car and will need to get there. So we do think that this satellite site will help Ms. Veier and the registrars deal with the influx and the volume of early voters. So I hope you will consider that. And one last request from the League of Women Voters. I hope you will all consider supporting Constitutional Amendment number 1 on the November 3rd ballot, which is an amendment that would create a Citizens Redistricting Commission and would make Virginia one of the leaders in the nation in getting rid of partisan gerrymandering and instead move to a bipartisan system of redistricting for legislative issues. Thank you so much.
Thank you. All right, is there anyone else? Even though you haven't signed up, you're free to come up, give your name, address, and you would have 4 minutes. Seeing no one come forward, I am going to go ahead and close this public hearing.
I'm not speaking, I'm just standing.
And we appreciate that.
Chair Council, I want to just make a statement for disclosure that I am a member of the League of Women Voters.
Okay, I thought you were going to do it before we voted on it, but does it make a difference as to when she makes disclosure?
No, it makes no. She doesn't have a conflict or anything. I think she just wanted to make that.
Okay. Supervisor Blevins, go ahead.
I just wanted to, for disclosure, that states that I am a member of the League of Women Voters.
Okay, thank you. All right, our next item up is public address. This is where the public is free to discuss anything that comes to their mind. We are not able to interact with you, but we will surely listen to you. If there's anyone that would like to come up for public address, we have no one that has signed up, and I've looked at it twice and made sure nobody's name was on it. And if anybody would like to come up, all you need to do is give your name and address and get the 4 minutes. Seeing no one, I am going to go ahead and close public address. Addendum, we actually have some addendum.
Yes, sir. We have two items to add under new business this evening, and they will be appointments for, did we add them under new business or consent? Consent, sorry. 2 items under consent agenda for appointments to the county's Economic Development Authority.
Okay, so they're going to be added to our
Consent agenda, yes, sir.
But probably need to say what those are, and then the board will have to add those.
Do I need to read the resolution or just the names?
I think just the names.
Okay.
Okay, the 2 people up for appointment are Samantha Livesey and Dr. Charmaine Troy.
Yes, and those are both 4 terms on the county's Economic Development Authority.
Okay, moving on. Items of consent.
We have to vote
Oh, we do have to vote that in
I move
addendum?
it,
to add to consent.
yeah, I
Okay,
move that
sorry.
we add that to the consent.
Do we have a second?
Second.
We have both, so, Madam Secretary.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Chair Chakowski?
Aye.
7 ayes.
Thank you.
7 ayes.
All right, now we move to items of consent. Is there a motion?
Motion.
Second.
We have a motion and a second. Do we have any discussion about it? No discussion? Madam Secretary, call the roll.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Chair Chakowski?
Aye.
7 ayes.
All right, next up, new business. First one is the ordinance amending Chapter 2, Section 2-31 to add forest harvesting and silviculture equipment to personal property tax exemption. Is there a motion?
I motion. But just so we can discuss.
Yeah, and I'll
Okay.
second it because I
All
have
right,
some
we have a
questions
motion
too.
and a second. Any discussion?
Yeah, this,
What does it mean?
all forest, is that for farmers or for anybody?
Yeah.
Marty, you want to take that one?
Yeah, it's for any equipment that's used in the forest harvesting or silviculture, which is basically cutting down trees, harvesting of trees.
Would that be for anybody?
Or is it just for
Tax
business?
exempt, or is it, I just noticed,
No, it's anyone that's operating a business whose equipment would be taxed. And now it would be exempt if you pass this.
Why would we do that?
do we have, anything on here, what usually we get off the tax revenue off of this equipment?
I don't know that we do.
Well, why is this on here?
We had discussed it in a previous meeting.
Yeah, but where did it come from? Like,
Oh, where did the request come from?
yeah,
State.
yeah.
So it was, if I remember correctly, and I'm trying to remember, which is a hard thing these days. We had a
with you.
request. We had a request from the silviculture industry folks that asked that this be added, that it was an eligible item that was eligible to be exempt from taxation, and they asked that their equipment be exempt, such as other items of farm equipment can be exempted as well.
I recall asking if we had any companies like that, and I believe the response was, we don't even have any in the county.
Marty, I'm trying to remember. Do you remember?
I don't know how many companies, but I give you a little bit more context. The General Assembly recently changed, and this is an exemption that localities have the option of adding to exempt. And right now you have all farm machinery and farm implements, but
Right.
that does not include anyone who's in the business or operating farms for silviculture that basically harvesting timber. And so they got the General Assembly to add this exemption, and then Craig forwarded it to me. He had received a letter from the industry asking, I think they're going statewide, all localities, asking that the localities consider exempting their property.
Yes,
So
yeah.
what I'm hearing is that a lobbyist got the General Assembly to add a loophole, and then they've come to us to lobby for us to also add that loophole to our tax code.
Yeah, I don't know. I haven't talked. I mean,
That's what it sounds like.
it's an association of people that are in this business.
Okay, thank you.
Okay, so if I own a piece of property that has timber on it and I hire a business to cut down the timber, their equipment would not be taxable?
If they are in the business of harvesting forest wood trees
For profit.
for profit, if they're in the business, because our current under Section 231 currently, the county exempts farm machinery and farm implements. So the industry's argument is we're in the farming industry as well. We just harvest trees for production. So why is our equipment not exempt?
I don't see the connection personally. Like, I'm not getting it. Like, a farm is a farm, and a business, I know a farm is a business too, but this is like a business coming in and doing something and not having to have their equipment taxed when we're taxing other people's equipment, right? I mean, I'm not getting why we should do this.
It seems to me that this is agriculture business, and that's why it makes sense to me. I'm used to people owning tracts of land and harvesting their timber more out eastern part of the state. I mean, the timber's grown practically just like a crop. It just takes a couple of decades to grow it, right? And then they clear cut it and they plant it all again, and it is an income. It's not much different than another farm product. Farms or this industry, I'm not used to these tracts of land being owned by large businesses, but I know that there are. I mean, especially up in Maine, the whole paper industry, they own thousands and hundreds of thousands of acres, right? But what I'm used to is small, family farms, family tracts of land that they cut the timber every several decades. And they have to contract for a company who has this equipment to do it properly so that they can plant again. And
Marty is correct that I was trying to go back and I can't find the letter. There was a change in the state code that allowed this personal property to be exempted if counties elected to do so. And that's what generated the request from the industry folks.
I don't suppose we would know if any other counties have already taken this up. And I don't think there are many companies that do this work. I think most of them travel and bring in their equipment. Now, their equipment is very expensive equipment.
Yes, sir. And Supervisor King asked a good question that I don't know the answer to. The company would have to be based in Montgomery County. The personal property would have to be in Montgomery County, and I don't know that we researched.
Could we find that out before we have to? Is there a hurry to do this?
No, ma'am. You've had the public hearing, and if the board were to elect to table this to a future meeting, pending more information, we can certainly do that.
I personally would like to do that.
Myself, I'd like to table this so we get more information on it.
I'm ready to vote.
Have two people interested in tabling it. Anyone else?
I'm perfectly fine with tabling it.
I mean, I just don't understand putting this in with farmers. I don't understand combining this with somebody that runs a farm.
And if I remember correctly, that's how the state addressed it and said the localities could adopt it if they so desired. Is that not correct, Marty?
Yeah, it's an option. You're not required to do it.
We didn't elect to put it in with farm equipment. That's how the state adopted the code change.
Well, I think the state recognized that it's not. When you think about farming, you don't think about cutting trees. I think is why they listed it as separate.
But like a farmer uses his or her equipment on their farm.
Right.
I get that. I don't get when you hire a business to do something why their equipment should not be taxed like everyone else's. Like, that's what I'm having a conflict about that. Because if that's the case, then, are other companies going to go through the General Assembly so that then they don't have to pay taxes too?
Many of them do. Many of them do every year.
And if
Yes,
we
ma'am.
pass this and then the General Assembly does that, then it's going to come we sort of, I don't know. If I had to vote on it tonight, I'm voting no. That's the way I feel. Good.
Well, I guess the question is, do we vote on it tonight or do we table it? I don't see a majority in favor of tabling it, so.
I kind of have mixed emotions about it because I understand your point about the farmer that uses his equipment on his farm, but guess what happens? That farmer also has a business selling hay or selling cattle or selling his product. So in that sense, I kind of see that it should be. I mean, just like the farm. I worked on a sawmill for 10 or 15 years when I was younger.
Yeah.
So I get it. But and there is a sawmill here in the county, isn't it? At least one out on Mud Pike. And I don't know if their equipment would fall in that.
And farmers contract businesses to do their work. So do those businesses that are contracted to cut hay or what have you, do those people have to pay taxes?
I'm sure they do.
On their equipment?
Yeah.
I would assume yes. The farmer doesn't pay on his equipment, his or her equipment, but
Right.
But if they own a lot of equipment to be able to do it, it could be exempt.
yes.
But if other businesses that don't own their own property and timber and stuff like that have this equipment, this resolution is saying they get to be exempt.
They are in Montgomery County and they have this equipment, yes.
Yeah, I don't think this is a matter of we should compare this to farming. It doesn't matter whether it's like farming or not like farming. They are asking for a exemption for their business.
On expensive equipment in for-profit businesses. We're not talking about Farmer Johnson's axe. We're talking about $1 million pieces of equipment that they want
Very
to
expensive.
not pay taxes on. I mean, it's lobbying. It's the strength of lobbying.
And if you remember, when they was doing the pipeline, several of us on this board was looking ways to tax their equipment that was in this county.
And we do.
And we did.
Yeah.
Supervisor Blevins?
I'm in agreement that I don't understand if it's for profit, why should they be exempt? If everybody else has to pay taxes on their equipment, I'm not seeing that. If it's a farm, but we're talking about a private business that's for profit, and we're saying that all of their equipment would be exempt from taxes, correct?
Yes.
That's what we're saying.
Well, it sounds
I
like
guess
we
I-
are ready to vote.
I guess what we're saying is that we really don't want a business like this in our county.
That's not what we're saying
But I
at
mean,
all.
so I'm assuming that other counties will probably allow this to happen, especially maybe out east.
It was
I think the General Assembly played tag, you're it. Like, let's please the lobbyists and give the counties the power to do this. And maybe some of them are going to, but that was the General Assembly's way of saying, here you go, have this on your plate. Enjoy it, counties.
and I can't speak to who else may have adopted because I honestly don't know who else has been asked to consider it. I'm assuming, based on the letter that we got, that probably every county in the state got the same letter because it's a new thing that the General Assembly had enacted.
But you bring up a good point, Sarah, that if a county next door to us does enact this exemption, then any business wanting to move in this region would be smarter to open up there. And then that county may not get the tax off the machinery, but they would get the tax off the business property. I don't know what that would be. I'm sure it would be a whole lot less than the taxes on those expensive machines, but
And I don't see that this would be a huge business in our county anyway. Onward NRV, everybody says, technology companies, self-driving vehicle companies, education, that's our county's goal for new businesses. So I think we can probably vote.
well, it's an interesting argument because if it's passed, then maybe a large company would want to locate here because we would be the only ones passing.
Stop.
Just trying to make it more complicated, if I could.
Do we know if we've had any businesses or farmers that have stated they
farmers.
are, no, okay, or anyone has come forward locally that would be in support of this?
I don't think
No
your
one
letter
ever-
was local, was it? No.
I think that's a good point. I mean, we don't even have to vote on this. Wait until somebody wants to relocate, and then we'll make the determination. We might have a better idea of what this really means to our county, you know?
You've had your public hearing to consider this amendment. You can certainly defer it to a future. How long can you go before you have to have a public hearing again?
I'll just say remove it.
I think it's generally a couple months and then we re-advertise.
But I mean,
Well, to play the devil's advocate on that, we could always vote tonight, and if an industry comes here, one of these type of industries comes here, we are empowered by the General Assembly to make the change. Thank you, General Assembly, to make the change to our tax code at that time to incentivize a business if we so choose.
I don't recall anybody speaking in favor of or against. So,
It also, if you took action, it's in response to their request, so you're not putting them off. So there's that too.
okay, I didn't hear all that.
The association actually requested the board to consider that exemption. So if you take action tonight, then you've responded to that request.
Okay, well, I think we're ready to vote then.
Let's do it.
Madam Secretary, if you'll call the roll.
Ms. Biggs?
No.
Ms. Blevins?
No.
Ms. Bowman?
no,
Mr. Motts?
No.
Mr. King?
No.
Mr. Shepherd?
No.
Chair Guzekowski?
No.
That's 7 noes.
That's what you call democracy right there.
I had no idea that one item would take that long.
Next item, ordinance establishing voter satellite offices for the 2020 general election. Is there a motion?
So
Motion.
moved.
Second.
We have a motion and a second. Any discussion? The only thing I'd like to say is thank you, Connie. Great job. I have to agree with Ms. Obenchain that it's very, very, very smart to do that.
May
Yes,
I
ma'am.
put a plug in? If you guys come across anyone that's willing to work with Connie, you can send their names to Connie because I've got a couple people that want to help out. So
Vice Chair.
no, just a comment. I also had a chance to talk to Sarah over at the Wonder Universe and ask her about the space and all that kind of stuff. And so I'm really grateful that a nonprofit in our community came to help, and it is a great location, centralized location to help serve our community. So thank you very much for everything that you've done. And through all my questioning, certainly understand a little bit of what you do and all the work you put in order to be prepared for the 18th. So thank you for everything that you do.
Any other discussion or comments?
I'd just like to say for Connie too, it seems like we're doing everything we can to make voting accessible, safe, and going through all the protocols. And I think Mr. Meadows had shared with us that most localities don't have but one, but we're going to have 2 satellite offices. So we're doing everything we can to make it accessible and safe for our citizens. And I just wanted to commend you. Excellent job.
Okay, Madam Secretary, if you call the roll.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowman?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Chair Guzekowski?
Aye.
7 noes.
All right, next item is establish the personal property relief percentage for 2020.
Motion.
Second.
We have a motion and a second. Any discussion?
Yeah, what happened to my 100%?
We're down to 37.21.
Sad.
Yeah, maybe someday. Any other discussion? Madam Secretary, if you call the roll.
Mr. King?
Aye.
Ms. Bowman?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
Next item is advertise proposed ordinance to continue county operations under COVID-19.
So moved.
Second.
We have a motion and a second. Any discussion?
Mr. Chair and board members, this is just to renew what we already have in place. It expires after 6 months, and we're in it 6 months now. We'll be in it 6 months next month.
I'm sure we're all hoping that we can meet in this room every meeting, but if things go badly, then we have this option. So that's very good. Anybody else? No? Okay, Madam Secretary, call a roll, please.
Mr. Shepherd?
Aye.
Mr. Motts?
Aye.
Mr. King?
Aye.
Ms. Blevins?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
Next item is school operating fiscal year 20 encumbrance carryovers.
Motion.
Second.
We have a motion and a second. Any discussion? I don't know. It looks like an awful lot of money. Sure? Everybody's okay? Madam Secretary, if you'll call the roll.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
Next item is the school operating fiscal year 20 carryover.
So moved.
Second.
We have a motion and a second. Any discussion? Madam Secretary, please call the roll.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
And for the trifecta, the next item is school capital funding carryovers.
So moved.
Second.
We have a motion and a second. Any discussion? Madam Secretary?
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
Next item is CARES funding for our second allocation.
Motion.
Second.
Now, y'all should have been fighting over that one.
Mm-hmm.
We have a motion and a second. Any discussion? Madam Secretary?
Mr. Shepherd?
Aye.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
And our last item is proclamation in support of International Overdose Awareness Day.
So
Motion.
moved.
Second.
We have a motion and a second. Any discussion? And of course, that is coming up on August 31st.
Mm-hmm.
Madam Secretary, if you'll call the roll.
Ms. Blevins?
Aye.
Mr. King?
Aye.
Ms. Bowden?
Aye.
Ms. Biggs?
Aye.
Mr. Motts?
Aye.
Mr. Shepherd?
Aye.
Chairperson Cassidy?
Aye.
7 ayes.
All right, now for everybody's favorite part of the meeting. Report from our county attorney.
I have no report, Mr.
Okay, no report. Our county administrator.
In the interest of time and the fact I've bombed y'all to death with emails the last week, I have no report either.
Whoa.
All right, well, moving right along. Let's see if we can keep this good thing going. We're going to go ahead and start with Supervisor Biggs.
I just wanted to thank county staff for all they do, and especially wanted to thank Craig for getting the task force members here tonight. I think that was really beneficial, and I'm glad that's going to go out to the public, and I'm looking forward to their continued communication. And the only other thing, I sent you all the notes from the VACO board meeting, and so you know what's going to happen with the virtual conference. And next year, it looks like if we have a real conference, again, it will be in Norfolk because the homestead won't be finished. So.
What are they doing to the homestead?
They were supposed to be renovating 200 rooms, and it was supposed to only take a year, but it looks like it's going to take longer than a year.
No, they picked a good year.
And yeah, and it was actually less expensive than what was going to happen if we'd had the conference in Norfolk. So, and the only other thing I'll say is that the VACO staff has been extremely busy sending out all kinds of communications with the special session and to the governor. So they're really working hard for us.
Yes.
All right, thank you. Supervisor DeMotts.
No report.
What? Supervisor Shepherd.
No report.
All right. Supervisor Blevins.
I just want to do a shout out to District B citizen and former Supervisor Christopher Tuck for being named Champion of the Valley for this year, for all of his dedication and service, and just want to say congratulations.
Very good. Supervisor King,
No report.
Vice Chair Bone.
Just a couple of things. Really appreciate the people who are involved in Dialogue on Race. Their event on Saturday was excellent. Also want to do a shout out to the Planning Commission. They made a report about the village planning during the commission, and they have some exciting things to share with us eventually. They're doing a fabulous job. It's great to know that we're doing it in-house also. Very talented people, impressive, as well as their work with the Regional Commission, I believe. So, and then I want to do a shout out to Bill Ellenbogen, District A resident, a champion of the Valley.
Okay, thank you. And on that note, we had a famous alumni that made that list. Chris Tuck was selected by the Regional Commission also. So, yeah, he did very well. Next thing I want to talk about is down in Shawsville, we had a concert. And I was very impressed with all the safety measures that they took. They took that football field and divided it up into 10-foot squares with separation. And they did that by lining it like you would any athletic field with that, I guess, the paint or chalk or whatever. They put lines down so that family groups could stay in their little square, sit in their chairs and enjoy the concert. And when they got up to move around, people put their masks on, and
Nice.
it was. I thought it turned out very well. And they've got another concert coming up in a couple of weeks. That's a makeup for one that was canceled, and I believe they're going to do the same thing. And
I think that's a wave of the future. I think
yeah,
concerts will be like that for a long time to come.
yeah. I've been hearing of concerts being done in cars where they, like drive-in type concerts. And yeah, I think people will find a way. People will find a way to have fun safely. So,
Live music will prevail.
that's right. That's right. I think that's all I got, unless somebody has something they forgot. If not, we are adjourned.
I think he didn't hear me.
Brag too soon on my internet connection.